Providing information for the public during a radiation disaster will be a challenge, even for teams of experienced communicators. In this training, we'll cover some of the resources and best practices you can use to improve how you communicate before, during, and after a radiation emergency. Hello, my name is Vivi Siegel. I'm a risk communication specialist in the National Center for Environmental Health at the Centers for Disease Control and Prevention, or CDC. Research has shown that radiation emergencies are poorly understood and feared by the public. Using communication principles to provide clear, prompt, and actionable messages is an essential part of addressing that fear and keeping communities safe. By empowering individuals to make informed choices, we help them take actions that can reduce their risk of harm. This training provides an overview of important communication principles within the context of a radiation emergency. Public health professionals, communicators, public information officers, and community stakeholders may find it helpful when reviewing and updating their response plans. CDC has developed a strategic approach to risk communication that is designed to help communicators manage the challenges that they will face during a disaster, and it builds upon what we know will work well in an emergency. This approach, the Crisis and Emergency Risk Communication Model, or CERC, will be the starting point of this training, after which we will cover some of the basic radiation topics that will be relevant during a nuclear or radiation disaster. We'll also share some of the common myths surrounding radiation and the correct information that you can use to address them. This training exists as part of an overall training and educational program that includes the tools and resources CDC has designed. I will highlight some of these resources throughout the training, and I hope that they and other resources you find on our website are useful as you develop and review your radiation emergency preparedness plans. The Crisis and Emergency Risk Communication Approach, or CERC, was first developed by CDC in 2002. CERC consolidates what we know about the psychology of a crisis and translates that knowledge into 6 communication principles. These principles are designed to help provide resonant and actionable information to the public within the incredibly challenging time constraints of an emergency. The 6 CERC principles are: be first, be right, be credible, express empathy, promote action, and show respect. Let's explore them in more depth. The first CERC principle is be first. In a crisis, people will actively be seeking out information on what they can do to keep themselves and their families safe. An agency responsible for that kind of information would want to get their message out to the public before other sources answer their questions with incorrect information. This is because people seeking information have a tendency to believe the first message they hear, and they use it as a benchmark for everything else they hear after it. By being as close to first as we can be, we make sure our message is front and center in people's minds, and we're also establishing ourselves as a go-to source for information. This leads into our next CERC principle: be right. It's very important to make sure that all of the information we're sharing with the public has been examined through a clearance process to ensure it is accurate in terms of content and to the situation at hand. We want people to have a degree of certainty about what's happening and the actions they should take. However, we know how quickly things can change in emergency. We won't have all of the information we need all at once. It's okay to share what we know now and let our audiences know that we're still waiting for more information. Finding a balance between message speed and certainty is something that CERC addresses, and a topic that we'll discuss later on in the training. But by handling uncertainty well, we lay a foundation for the next CERC principle: be credible. As communicators, we know that one of the most important things we can preserve during an emergency is our reputation as a credible source of information. While being first and right are factors that affect our credibility, Message testing also tells us that a person will judge message credibility in large part by the person or agency that delivers that message. Selecting spokespeople who resonate with the community is a critical step when planning message delivery. The fourth CERC principle involves expressing empathy, which in this context means that we communicate in a way that demonstrates compassion and validation of the emotions and impact caused by an event. Expressing empathy is one of the most important points for establishing connection and trust with our audiences. And when expressing it, it should be a noticeable part of how you deliver your message. As the saying goes, if they don't know that we care, they don't care what we know. Once we have messages that are prompt, accurate, and empathetic, they also need to promote action, the fifth principle in CERC. In an emergency, people want to know how to keep themselves and their loved ones safe. They want to know what to do. If people don't have a productive action to take, they'll start taking unproductive actions that could lead to greater harm. Because of this, we work to make sure that all of our messages have a clear action step. Finally, meaningful emergency communications include understanding and respect for audiences, their cultures, their languages, and their beliefs. This also includes respect for any barriers they might have to doing the action steps that we're recommending. We've included 4 discussion scenarios throughout this training to practice some of the concepts we're learning. In each one, I'll describe a scenario related to a radiation emergency, present a discussion question, and give you a moment to pause the video and think through how you would respond. After a few seconds, I'll return and share one possible example of how the question could be answered. For this first scenario, let's imagine that a nuclear power plant in the county of your local health department caught fire last night. The fire was quickly contained, and an initial survey of the damage to the plant conducted by radiation experts is expected to show that there is no risk of harm to the public. But individuals were quick to post pictures of the smoke, emergency vehicles, and firefighter crews on social media, which has resulted in anxious community members who are worried about the safety of their families and pets. As lead communicator, you are about to provide an official update to the community. Consider the 6 CERC principles. Part 1. What's the first thing you would say during your update? And part 2. How would you incorporate the 4th CERC principle, expressing empathy? Part 1. It's clear from this scenario that the power plant fire has caused an emotional response in the community that may not match the actual risk of harm. As such, a communication priority would be to speak to the anxiety expressed by the community. Using CERC principles, we would aim to have a credible speaker frame our first messages in a way that validates the anxiety the community members feel and presents how the facts of the emergency are guiding our actions now and in the future. Part 2. This approach incorporates many of the CERC principles, including the 4th, expressing empathy. At the beginning of the message, we should acknowledge the emotions this scenario is causing and link that awareness with specific actions. An example of a message that addresses the anxiety the community feels could be the following. The power plant fire last night has caused a lot of fear about personal and family safety. Because of this, we asked safety and radiation experts to assess the health risks posed by the power plant fire. The result of their analysis was that the fire did not pose a health risk because of where it was located and because it was controlled quickly. We will be conducting an extensive review to make sure this doesn't happen again, and we will provide an update next week. If you have questions or concerns, call or visit our agency's website. We apply the 6 CERC principles across all of our emergency communication activities to ensure they are relevant, actionable, and address the confusion and anxiety people will likely feel during an emergency. Managing that fear is even more important if the emergency includes radiation exposure or contamination. To explain why, let's explore some basic radiation concepts and how they factor into message planning. One of the main reasons radiation is feared is that you can't see it, you can't smell it, you can't hear it, and you can't taste it. You can only tell when harmful radiation is present by using specialized equipment. The consequences of radiation are often confusing because many times the only examples people have of radiation's effects come from comics, games, and movies. This combination of fear and misinformation can increase the level of risk people perceive in an emergency, and it can lead to choices that put themselves and their families at greater risk of harm. One way to visualize risk perception is by using the hazard versus outrage function proposed by Dr. Peter Sandman. In this model, perceived risk is made up of an individual's thoughts about the hazard and the outrage they feel when it occurs. Some things can cause people to feel more outrage than others, such as if a hazard is imposed on you versus voluntary, if it's something unfamiliar versus familiar, or if it seems unnatural or unfair. Based on these principles, radiation emergencies, which are rare and unfamiliar, often evoke more outrage than natural disasters. For example, a nuclear power plant release may end up causing a very small hazard for those people who are closest to it. But the outrage and fear that people feel, both near and far away, will likely be very high. It's important to remember that these perceptions, even if not based on a real risk of harm, are very real to the people who have them. That is why we must communicate in a way that shows that we see and are responding to the perceived risk and outrage that people feel. For this reason, CERC principles, which address both facts and feelings, are considered especially effective in radiation emergencies. We know that effective communication can save lives by reducing fear and confusion and by empowering people to make wise choices. For example, during a radiation emergency, we know the most important, immediate message we can tell people is to get inside, and stay tuned. We also know that encouraging people to shelter in place when needed not only helps to keep people safe, but also allows emergency responders to work as fast and efficiently as they can. One of the keys to effective communication is not just knowing what to say, but also how to say it. This means communicators should know the basics about radiation emergencies, terms, and measurements, while also understanding how to use the right level of detail. There are different types of radiation emergencies, categorized into radiological and nuclear incidents. Let's define both categories. Radiological incidents cause accidental or intentional harm through the use of radioactive material. For example, a transportation accident that spills radioactive material onto a road or into a stream. A radiological exposure device, or RED, where radioactive material is strategically placed to expose large numbers of people with high doses of radiation. A radiological dispersal device, or RDD, which uses a conventional explosion or distribution device to contaminate a large area with radioactive material. Nuclear emergencies are a special kind of radiation emergency that use a nuclear reaction to create a large explosion. Two examples would include a nuclear warhead or an improvised nuclear device, or IND, which is an illegally made nuclear bomb. Nuclear emergencies create the greatest amount of damage and loss of life, and may also disable commonly available modes of transportation, communication services, and sources of food, water, and medical attention. Planning in advance for communication pathways that can accommodate those challenges will be very important. Those challenges are also the reason why many of our message testing sessions are based on an IND scenario. Infographics and more information on each specific disaster type can be found on our website. Talking about radiation often involves a number of terms that can be potentially confusing. While our website has an extensive glossary of these terms, in this training we'll go over some of the ones that are more frequently misunderstood. Radiation comes in many forms, and in the simplest terms is the release of energy, either as a particle or a wave. The release of that energy can either be strong enough to damage cells or not. So we can think of radiation as split into two categories. One, radiation that cannot damage cells, such as light and radio waves. And two, radiation that can damage cells, such as X-rays. Radiation that does not damage cells is called non-ionizing radiation. Radiation that can damage cells is called ionizing radiation. The radiation we're focusing on today, and the type that people should be concerned about, is ionizing radiation. Radiation can also be confusing because there are two different measurement systems used in the world to talk about it. Each system contains a number of unit terms to quantify radiation in order to describe things like radioactivity, dose, and biologic risk. For example, to report radiation dose, we can use either the international unit for dose, the sievert or the Gray, or the United States units for dose, the rem or the rad. These units are often measured in smaller quantities, so it's common to see variations such as millisievert or millirem. Because of the potential for confusion, a strong communication strategy will seek to build relationships with radiation experts who can understand and translate between these measurement systems. This is important for a couple of reasons. People will want to know radiation numbers, even when they don't know what they mean. And communication teams will need to provide the right level of detail to the public in a thoughtful way to reduce fear and help guide how people interpret what those numbers mean for their family's safety. As we saw in the Fukushima disaster, emergencies with an international scope will require communicators and scientists to translate radiation information from one measurement system to another. This translation can challenge emergency response by introducing human error, time delays, and increased confusion. More information about radiation measurement can be found on the CDC website. Another set of terms that can be confusing for people are contamination and exposure. Let's take a look at the following video with Dr. Armin Ansari, which helps explain the difference.
Decontamination is just a big word for washing or getting contamination off your body or an object. Understanding a couple of concepts are really important to the subject of contamination, so I want to review those with you. It's important to distinguish radioactive material from the radiation that they emit. Those two are different things. And it's also important to differentiate between exposure and contamination. So let's come back to this jar, and let's say that we have some radioactive material in this jar that emits gamma rays. So you remember the gamma rays would go through the glass. So I have the radioactive material here contained in the jar, but radiation that it emits would leave the jar through the glass and will come right at me at the speed of light, right? Okay, so I'm being exposed to the radiation. I'm being exposed to radiation that this material emits. But I'm not in contact with the radioactive material, because radioactive material is contained here. I'm just being exposed to the radiation that it emits. So if I were to leave the room right here, I won't carry anything with me, because radiation comes at me at the speed of light, does what it does, and it's gone. I leave the room, I'm not carrying anything with me. This is a lot like getting a CT scan or an X-ray. Get exposed to radiation and you go, you're not carrying anything with you. Now, if I were to open this jar and stick my finger in it, now this is contamination, because now I've got the radioactive material on my finger. So contamination is when radioactive material is somewhere that it shouldn't be. It's not supposed to be. It was not supposed to be on my finger. So that's contamination. And now that my finger is contaminated, say I didn't know that, I don't know, so I go ahead and touch my hand here, and I touch my clothes. So my clothing becomes contaminated, and my skin becomes contaminated. And this is called external contamination, the contamination that you have external to your body, either on skin or clothing, external contamination. And when you're contaminated, guess what? You're also being exposed, right? Because radioactive material in the jar emits radiation. radioactive material on your skin emits radiation too. So right now I'm being exposed also. I'm contaminated. And if I were to leave the area, I'm carrying that contamination with me. I'm also being radiated as I go. So this is different than just a simple exposure. And also, maybe if I don't wash my hands and go eat a sandwich, or if I touch my face and this material gets inside me, it becomes internal contamination. So when radioactive material is inside your body, that's called internal contamination. If it's outside your body, external contamination. The way we internalize contamination is through ingestion, eating, breathing radioactive material, or if I had an open wound and got contaminated, it would enter my bloodstream in that manner. And internal contamination is a health risk. It's something we want to avoid. And as you can tell, most of the times internal contamination starts from external contamination. So if you can manage to control external contamination, we can also help minimize the risk of internal contamination.
We just heard how radiation exposure is different than contamination with radioactive particles. But people will also want to know what they should do if they have external contamination on them. The good news is that external contamination, or when a radioactive source is on the surface of your body, clothes, or your hair, it behaves a lot like mud. It can be removed by carefully taking off your clothes and taking a shower. This process of cleaning radioactive particles off of your body is called decontamination. Once it's removed, you can avoid further radiation exposure by putting those contaminated objects in a bag and putting distance and barriers between you and those objects. To learn more, please visit our website for a full review of decontamination guidelines. Let's talk briefly about the next potentially confusing term, medical countermeasures. They are medicines that, when used appropriately, help protect the body from a few specific sources of internal contamination, or can help the body recover from the effects of radiation exposure. Past radiation emergencies have shown us that people will ask a lot of questions about medical countermeasures. Some people may demand them, even when we know that they would be ineffective in that situation. So as communicators, it's very important that we help people understand what medical countermeasures are and what they can and cannot do. We need to keep a few points in mind. Medical countermeasures only work for a few types of internal contamination. If warranted, their benefit is often dependent on how quickly a person can take them after becoming internally contaminated. Taking a medical countermeasure too late may greatly reduce the benefit it provides. Taking them is not risk-free. Some medical countermeasures can cause complications if taken inappropriately. Using them should only be done with the guidance of medical professionals. As we've just covered, the topic of radiation comes with a number of terms and definitions that can be confusing to both professionals and the general public. As communicators, it's important that we understand radiation concepts, but it's equally important that we build messages that work in tandem with a person's mental state and priorities in an emergency. Finding the right amount of detail requires that we understand how people think, feel, and act in an emergency. We know that people will be stressed during a disaster, and that in times of stress, our minds comprehend and hold on to much less information than when we're calm and collected. Because of this, our communication to others should accommodate that stress level by being clear, concise, and relevant to what matters to them. Giving too much detail or using terms that are poorly understood can easily lead to people disregarding your message in favor of one that's easier to understand, even though it might be incorrect. For our next scenario, let's return to the fire that occurred in the power plant. In the weeks after the fire, the preparedness plans in counties across the state fell under increased scrutiny, especially regarding radiation emergency preparedness. Because of this increased public interest, your county wants to share more about radiation basics. You are the communication lead for your county. Along with developing other resources, you have tasked your team with creating a one-page summary of how individuals can minimize their exposure to radiation. They decide to focus on the concepts of time, distance, and shielding. Part 1. What resources could they use to learn more about radiation topics in preparation for their summary? Part 2. How would they describe the concepts of time, distance, and shielding as they relate to reducing radiation exposure? Part 1. The Centers for Disease Control and Prevention, the Nuclear Regulatory Commission, and the Environmental Protection Agency all have resources available online to educate about radiation. In particular, CDC has an e-learning course, Radiation Basics Made Simple, as well as an online radiation dictionary for looking up radiation emergency preparedness topics. Part 2. When talking about time, distance, and shielding, time refers to the amount of time you spend near a radioactive source. For example, time in front of an active X-ray machine. Distance refers to how close you are to the radioactive source, which is why radiation technologists leave the room when they turn on the machine. Shielding yourself from a radiation source means you put something in between you and the radiation source. So, in our X-ray example, this is the reason why you're told to wear a lead apron to shield parts of your body when receiving an X-ray. That's also the principle behind why we ask people to take shelter in basements or inside buildings during a radiation emergency. The walls act as shields. For more information about time, distance, and shielding, visit CDC's website. In addition to confusing terms, communicators also are dealing with many myths that people may believe about radiation, what it can do, and how to stay safe. On our website, we've described 7 of the most common myths we encounter after a radiation emergency. Over the next few minutes, we'll cover 3 of those myths and describe how communicators can prepare for and diffuse them. One common myth is the idea that there is nothing you can do to protect yourself from radiation exposure. This belief builds on the fatalism people often feel when facing a radiation emergency.
Radiation is scary because if you're being exposed, there's nothing you can do to protect yourself.
Well, if radiation gets in you, it's there. It stays with you forever, the rest of your life.
The harm caused by this myth is that if people really think that there's nothing that they can do to protect themselves, there's a good chance that they won't do anything. This adds additional stress on the individual and places them and their loved ones at greater risk. Luckily, there are things people can do to protect themselves. Even in a nuclear detonation, the actions they take can make a difference to help protect their health and potentially their lives. The most important protective actions to take immediately after a radiation emergency are to get inside, and stay tuned for more information. As communicators, we need to provide clear, easy-to-follow protective action messages that are tailored to different audiences and different geographic areas. This graphic shows one way that we might group audiences and contains examples of how geographic location can prioritize different action messages. Those closest to the event will need immediate life-saving messages. Farther out, people will still have questions about their safety, but they might have a different set of actions to take. Some examples of actions for those outside the immediate emergency area may be to stay outside of the affected area and to keep phone lines clear for emergency responders. Another recommendation may be to direct people's questions to a hotline where concerned individuals can hear updates about family and friends who might be in the affected area. We also need to prepare messages for people who are further away from the emergency. After the Fukushima incident, we found that people on the west coast of the United States were really worried about potential radioactive contamination coming over the ocean from Japan. Being concerned, they wanted to do something. Unfortunately, they started to take potassium iodide, or Ki, hoping that it would protect them. That was an unhelpful and potentially harmful action to take for a few reasons. In that emergency, Ki wouldn't have provided any medical benefit against the type of radiation potentially affecting the U.S. West Coast. Furthermore, KI can actually cause problems if you take it when you don't need it. KI is only helpful when taken within a very short time window and if you've received a specific amount of exposure. Those living on the West Coast didn't meet either of those requirements. Across all these audience groups, a consistent finding is that people want something to do in an emergency. With the right guidance, communication teams can help guide those actions towards ones that promote safety and reduce anxiety. We also see myths about the amount of radiation it takes to cause harm or cancer. A common fear is that even very small doses of radiation will cause harm. Luckily, that's not necessarily true. The CDC has developed a number of tools to help communicate how concerned people should be about a particular amount of radiation. So let's go over a few of those now. One useful tool designed to be used in emergencies is called the Radiation Hazard Scale. In it, we identify different categories of exposure and associate them with simple numbers and colors. The idea is that this scale could be used in an emergency to pair protective actions alongside maps to show people in different areas what they can do. It also helps simplify the idea of risk reduction. For example, if someone is currently in an area that is a radiation hazard category 3, they may be able to take protective actions to lower themselves to a category 2 or 1. Another helpful tool is the radiation thermometer, a slider-based tool that we use as a way to help people understand how different activities expose us to different levels of radiation. It also allows people to look at different doses and the potential health effects we might expect from common and uncommon events. For example, exposure to sunshine, flying across the country, and medical exposures. Both of these tools can be found on our website. The last radiation myth we'll cover today involves medical professionals who are concerned for their own safety when providing care for others. The myth is that it's not safe to care for people who are exposed to or contaminated with radioactive material. The reality is that many hospitals have plans in place for dealing with natural or human-made disasters. These plans and the equipment to support them will help minimize a caregiver's risk when providing care. When medical professionals wear appropriate protective equipment, they are at minimal risk of harm when caring for someone with radiation exposure and external contamination. If internal contamination or embedded radioactive shrapnel is identified during the screening process, those patients will be triaged in an appropriate manner, and additional precautions will be taken. Remember, people exposed to radiation do not pose a risk to others. And if a person is externally contaminated, they can decontaminate themselves to remove a large portion of any radioactive material present on the surface of the body. Another question we hear relates to patients who arrive needing life-saving care but have not yet been decontaminated. In a radiation emergency, the scientific consensus is that life-saving care should be provided before decontamination and should not be delayed due to radiation concerns. Once stabilized, a person can continue with the decontamination process. As communicators, we need to be prepared with messages and resources that defuse these myths. By doing so, we help the public and medical providers keep themselves and their loved ones safe, and we empower them to better help their communities by assuming their roles within emergency response. An important part of ensuring providers are ready to act is to provide them with all needed information and training before an emergency occurs. To help with this, CDC has developed a clinician toolkit full of videos, planning documents, and other resources. That toolkit, along with a full list of myths and the strategies used to address them, can be found on our website. Now, let's consider a scenario involving the detonation of an improvised nuclear device, or IND. You're part of the local communication team assembled in the hours after a 10-kiloton IND exploded almost 35 miles away. Your team has been asked to update the public, and you plan on using CDC's Radiation Hazard Scale to frame the protective actions people should take in various parts of the community. Part 1. How would you use the radiation hazard scale as you plan for and communicate your recommendations? Part 2. Provide one example message using the radiation hazard scale. Part 1. The radiation hazard scale is designed to be used during radiation emergencies to clarify what actions are recommended for specific geographic areas. It provides this information using 5 color-coded categories based on the risk attributed to that area. A communicator working with the scale would first coordinate with radiation experts to identify the appropriate protective actions for each risk category. Then they would craft messages that link recommended actions with the risk categories of the scale. They can deliver those messages alongside a color-coded area map depicting the risk zones. And this way, the community can visualize where risk exists and what actions they can take to protect themselves based on where they are. Part 2. A message using the radiation hazard scale might sound like this. In areas where the radiation hazard category is 5, sheltering in place can help lower your risk to a category 2 or 3. If you try to evacuate before it's safe to do so, you'll expose yourself to the higher level of risk. Now that we've covered some radiation terms and concepts, let's look at what the research says are best practices when developing messages for a radiation emergency. CDC and its partners have conducted message testing over the past decade to clarify how message format and content can help people understand information and take action more easily. One major set of focus groups that we conducted in 2011 led to a number of insights about communicating during an improvised nuclear device, or IND, scenario. The study was conducted by showing the focus groups an introduction video to set the scene of what they might see in the immediate aftermath of an IND explosion. Then, we provided a number of messages in audio and written formats to explore what they understood and if they found them relevant, impactful, and credible. Let's go through some of the lessons learned from what they discussed. The most common thing that people wanted to know was, how do I keep myself and my family safe? So if you're speaking with people and you have not already told them how to stay safe, their attention may not last long, and they may start to take actions that put themselves and others at greater risk. We also found that even among highly educated people, radiation-specific terms, concepts, and risks were poorly understood, and often they needed to be clarified. While it's important to have in-depth information readily available for people who want or need it, most of our messages to the public can communicate risks and actions without using technical terms. For example, we've learned that using the word wash is much more effective than decontaminate when we're guiding people to clean external contamination off of themselves. Similarly, we found that explaining the concept of decontamination works better when we tell people it's like removing mud off the body. Confusion may also occur when two messages appear to conflict with each other. For example, recommending that tap water is safe to use to shower and rinse food, but not safe to drink. A person might not understand why water that you shouldn't drink you can use on your body or food. In this case, explaining why with extra details can be helpful to frame the action in a more understandable way. For example, the amount of radiation that you would be ingesting would be so slight if you're rinsing food or taking a shower, but it would be more if you're drinking a glass of water. Keeping our words and concepts familiar is a critical finding in this research. Another way this shows up in the research is when we're dealing with uncertainty. People in an emergency want to know what we're certain about, and they can react poorly to messages that appear to avoid clarity. For example, words like may, might, or could. As communicators, avoiding uncertainty can be hard for many reasons. First, in an emergency, we may not know all of the facts right away. We might have to balance the message speed with the amount of information we're able to give. Second, People in scientific fields are much more comfortable with the idea of statistical probability and the scientific process where knowledge is open to revision as new information is discovered. This often leads to writing in a way that doesn't resonate with people who are afraid and who want absolute certainty. For example, we might be able to tell you that radiation exposure can raise your risk of cancer, but we won't be able to tell you how much any one person's individual risk will increase. One way to address this is to be clear about what we know, what we don't know, what we're doing to learn more, and when we plan to provide an update. This lets people know what they can expect. It's an approach that helps build trust, acknowledging that there is uncertainty and showing empathy for the discomfort that causes can in itself help people deal with the uncertainty. Just as uncertainty needs to be handled carefully, we've also found that reassurance needs the same kind of care. We know people are afraid of uncertainty and have a strong urge to protect themselves and their families. Because of this, they often resist any message that appears to discount or downplay what they're afraid of. The fact is, whether they should be or not, people are afraid, and they need to know that we understand what they're afraid of and why. This is why CERC principles are so helpful, because they help ensure that messages are constructed with respect and empathy. Messages should acknowledge what people are afraid of, state what we know in non-technical terms, and then frame how that knowledge guides actions that people can take. Again, it may help to state what you still don't know and what you're doing to find out more. If we don't do this, people might feel that we're out of touch with what their reality is, or worse, that we're talking down to them. Even if we get everything right in our messages, there's still a lot of factors that can influence whether or not people follow our advice. For example, we found that people who are pregnant or nursing are more likely to follow instructions from authorities. Testing showed that people might not follow our directions for a number of reasons. For one, people don't think that decontamination or washing works. Because radiation cannot be smelled or seen, we found that people sometimes express fatalism and fear that taking off clothes or washing the body, steps common in the decontamination process, will not be enough to reduce their risk of harm from radiation. If people are at a community reception center, staff will have radiation survey meters to show how much contamination, if any, remains after going through the wash station. But people who are sheltering at home won't have access to radiation measurements, and this could cause them to become more anxious. If people understand why washing works, they're more likely to do it. That's why it's important to educate the public before something happens with clear messages about decontamination and why it helps reduce radiation exposure. We also found that people were resistant to the idea of sheltering in place. Now, this is partly because they don't always understand how sheltering in place keeps them safe, so we need to do a better job explaining that shielding principle. But people were also very concerned about the safety of people they care about. Very often, their first reaction was the desire to leave the shelter and make sure their kids, loved ones, and pets were safe. For example, I would want to make sure my kids are safe at school. But if I leave my shelter, I put myself at risk. Addressing this fear includes building confidence in the sheltering process, as well as in a facility's ability to keep people safe and communicate updates during an emergency. I need to know that my children's school has a plan in place to keep them safe, and that they've practiced that plan. Every step of the planning and exercise effort should be communicated to parents and stakeholders in advance, and allow for meaningful feedback and participation. Our focus group research also provided a number of recommendations for communicators. Many of these recommendations can be applied in advance. The first recommendation is to make sure each message has an action associated with it. Providing actions gives people a focus for their energy, and explaining why an action is recommended, like why we decontaminate, increases the likelihood that people take those actions. The next recommendation is to avoid technical radiation jargon and instead use plain language to decrease confusion and increase how quickly people understand what the main message is. We also advise using visuals and pictures as a great way to highlight your main message and recommended actions. CDC has translated a number of radiation topics into infographics, and those can be found on our website. As I said before, we don't want to be overly reassuring, but it is important to let people know that there is hope and that the actions that we're recommending are highly protective. And if they take them, they will be better off than if they don't. Avoiding contradictions will be one of the most difficult things to do because there will be many other people releasing messages. Our partners, social media, and formal media channels will be sharing information as well. If different messages are coming out from different places, people won't know which ones to believe, and they may take actions out of fear, frustration, and confusion. We won't be able to completely control the narrative. Using CERC principles to maintain consistency with yourself and your partners is one of the best ways to add strength to your communication campaign. While no small effort to accomplish, working together to share the same message helps the public trust in what we're asking them to do. It's also important to choose a trusted spokesperson. We've found that radiation scientists, medical professionals, and people who are viewed as being part of the audience's community are more likely to be considered trusted sources of information. Planning for and including their participation will help encourage people to listen to the messages you're sending out. It's also important to consider how those messages and actions change if the person's in a different location or environment. For example, what happens if you're on the road? Or what happens if you have kids? Planning for these challenges can help reduce the barriers people encounter when considering your recommended actions. Messages can also be tailored for different audience groups and emergency phases. For communication teams that manage messaging across diverse populations, it often makes sense to develop different message sets for each important population group. For example, in a radiation emergency, pregnant women will have special radiation exposure considerations, so it makes sense to develop a set of messages especially for that group. It's also important to consider how the actions and information contained in your messages will change across those audience groups over a period of hours and days as the emergency response evolves. The following chart can be a helpful starting point when thinking through the messaging needs for each phase of an emergency. Being prepared in advance of a radiation emergency is one of the most important things you can do. This means building relationships with partners and the community and providing all needed education, training, and planning before an emergency occurs. Doing so allows basic emergency operations and communications to flow well enough to accommodate all the demands of an emergency that were unexpected. Being prepared also includes backup plans to ensure communication, resources, and response activities can continue if usual media and logistics channels are damaged or disabled. Contingency planning around the absence of electricity, the internet, or radio can help reveal critical gaps in existing plans. For example, do you have a way to send text messages? Do you have a way to get information printed and distributed if there's no electricity? Have you coordinated your backup plans with partners and responders? By understanding how your response builds into other local, state, and federal emergency response efforts, emergency response professionals can reduce redundancy and leverage the capabilities of other surrounding agencies. In the first 12 hours after a nuclear disaster, people will have immediate life-saving questions. Some of those questions include, how do I protect myself? Do I need medical attention? Can I breathe the air? Can I drink tap water? Do I need to evacuate? And if so, where do I go? Where are the shelters? And other logistical questions. After 12 hours, most people will start to think more broadly about the affected area. What are the long-term effects on my health and property? If I evacuated, when can I return home? Can I eat food grown in this area? Is the soil safe for my kids and pets? How will the value of my home change? These questions will help us prepare for long-term communications planning. As we saw with the Fukushima disaster in Japan, a radiation emergency can very easily become a long-term event. Once the immediate event is contained, there are often long-term monitoring and cleanup considerations to address, and people will have ongoing concerns and fears for months, if not years, afterwards. Some of these concerns include health issues from long-term exposures, developmental effects on children, cancer concerns, and infrastructure and economic impact. Fukushima reinforced the importance of having a long-term communication plan and to ensure that information is repeated, consistent, and targeted to address myths and incorrect perceptions. Continuing with our IND scenario, now imagine you are a community member who has been ordered to evacuate your home. You've been away for several weeks, and after a thorough inspection of the area, the county government has found that the radiation levels are low enough to give the okay to return home next week. The county has also offered to host a town hall to ensure everyone can get their questions answered. What are 3 questions you would want answered before you felt safe enough to return to your home? In 2017 and 2018, the CDC tested post-evacuation re-entry messages in focus groups, and we found participants were concerned about a number of topics, including: how did the government determine that the area is safe? How will safety be assessed in the future? If there is an increased risk of harm, how much harm is it as compared to more commonly understood risks? Are there any unique considerations for water, food, air, plants, pets, or special populations? If there are any risks to food and water, how will people be able to independently verify that these things are safe? What personal actions should be taken to maintain safety, and what's the time frame for those actions? Are there specific guidelines that should be followed? And who do I contact if I have additional questions? In 2013, the CDC and other relevant agencies took a combined look at 2 topics related to nuclear and radiation messaging: response to an improvised nuclear device, or IND, and communicating after a nuclear power plant incident. This review produced 2 reports that provide guidance and templates on a number of radiation topics. Communicators and public information officers, or PIOs, are encouraged to review these reports to help improve their own communication plans. Even more information on messaging can be found on our website, including frequently asked questions, a radiation dictionary, training videos on radiation basics, and multiple resources on the crisis and emergency risk communication approach. This also includes materials in different languages. Communicators can increase the effectiveness of their plans and campaigns by keeping CERC principles in mind and understanding the lessons learned from messaging research. With advanced preparation and partnerships, we can empower communities to manage radiation emergencies in a way that reduces anxiety and gives people helpful ways to keep themselves and their loved ones safe. For more on these resources and other radiation emergency guidance, be sure to visit our website.